Are you a woman over 35 and you're struggling with weight gain, brain fog, low mood, low energy, and you feel like your hormones are off and you want to try hormone replacement therapy, but you don't know if it's right for you? Well, my name is Dr. Khalil and I'm a licensed naturopathic doctor. And one of the biggest misconceptions I see in clinical practice is this: women believe HRT is going to fix everything. The weight gain, the fatigue, the gut issues, the anxiety, the poor sleep, the brain fog. There's a lot of conversation right now around HRT, especially since the regulatory warnings from the FDA have been reevaluated. More women are considering it at younger ages. And while HRT can absolutely be a powerful tool and appropriate tool for the right woman at the right time, what I see far more often is this: women are trying to use hormones to fix problems that hormones didn't entirely create, because estrogen will not reverse insulin resistance. Estrogen and hormones will not eradicate gut dysbiosis or yeast overgrowth. Hormones will not fix a chronically dysregulated nervous system, and it will not build muscle mass from nothing. Also, it will not correct years of metabolic dysfunction. Now, I want to make it clear, this video is not anti-HRT, nor is it pro-HRT. It's about something far more important. It's the foundations that needs to be assessed before hormones are even part of the conversation. Because in clinical practice, the women who do best on or off HRT are the ones who don't rush to hormones. They're the ones who actually build a foundation first. They really focus on the foundations of health. So today in this video, we're going to talk about the 5 foundations of health before HRT should even be brought into the conversation with you and your doctor. Okay, so foundation number 1 is going to be metabolic health, which is the hidden driver of hormonal weight gain. And it's probably the most overlooked factor in perimenopausal health. A woman gains 15 to 20 pounds in her late 30s or 40s and immediately assumes it's her hormones. And yes, hormones do play a role, especially when estrogen declines or progesterone begins to dip as well. But what I often find in clinical practice is something far more foundational, which is insulin dysregulation. And this includes increased abdominal adiposity, so belly fat, cravings for sugar, low muscle mass, pre-diabetic numbers, skin tags. Insulin is one of the most powerful growth signaling hormones in the body. It fuels fat cells. And when it's chronically elevated, nothing really works optimally. So I often hear things in clinical practice: I barely eat anything and I can't lose weight. But proper metabolic function is never assessed in yearly lab work. This is why whenever a woman comes to see me in clinical practice, I look at blood work, detailed blood work. So fasting insulin, HbA1c, fasting glucose, waist circumference, body composition, inflammatory markers, visceral fat, not just blood work. We're looking at different markers, because if metabolic health is unstable, adding hormones does not correct the underlying physiology. So if you want to learn more about insulin resistance, I have a video on it with a little bit more of a detailed approach. Now let's get into the foundations of health that needs to be discussed before HRT. Number 2, which is muscle mass. So muscle is an endocrine organ. It's basically a glucose sponge. It's closely tied to metabolic health. And what I want to tell you is what you see on social media with, all these women lifting weights, so many fitness influencers, is not the average person. Most women that I see are not lifting weights. And I want to make it clear, muscle is not just for aesthetic reasons. It's metabolic tissue. It regulates glucose disposal, insulin sensitivity, it downregulates inflammation, mitochondrial output, which is needed for energy, and long-term metabolic resilience. So it reduces your risk of diabetes, prediabetes, and all of the metabolic problems. One of the most consistent patterns I see is significantly under-muscled women. Not because women aren't active, but because they're not strength training in a progressive, structured way that builds actual muscle. So if you want to go ahead and do yoga, Pilates, walking, go ahead and do that. It's important, right? It helps to decrease stress. It helps to support mobility, and also mobility of the smaller muscles, but it does not replace resistance training. So basically what happens when you don't lift weights is that your metabolism slows down, your body composition shifts, weight becomes stubborn, and then the assumption becomes, I need hormones. But sometimes what the body is actually missing is not just estrogen, it's muscle tissue acting as a metabolic buffer that you need. So start with lifting weights 3 to 4 times per week and then move into progressive overload. Skip the excessive cardio and the excessive HIIT classes. It really just stresses the body and spikes cortisol. Okay, now let's talk about foundation number 4. This is basically your lifestyle. So your stress levels, your sleep, nervous system regulation, and it's probably the most underestimated driver of symptoms. In clinical practice, many women are simply not hormonally imbalanced. They're physiologically exhausted. They're raising children, they're running businesses, they're managing aging parents, they're going through relationship stress, carrying chronic mental load. And their nervous system has been in survival mode for years. They're waking up, between 2 and 3 in the morning. They're having fatigue, they're having poor recovery, they're dealing with anxiety. And the assumption becomes, I need hormones. But often what I see is this: sleep deprivation, scrolling before bed as their only quiet time, cortisol dysregulation, low magnesium status, excessive nighttime stimulation. So doing anything that kind of keeps you awake at night, whether that's watching TV or even doing like a late night workout. In many cases, what is needed is nervous system re-regulation, not hormonal intervention. Because if the nervous system is chronically in a fight or flight state, hormones cannot often express themselves properly anyway. Now let's talk about foundation number 4. One of the most overlooked aspects of hormone health is gut health. Many women don't realize that hormones don't simply get produced and disappear. They need to be metabolized, processed, eliminated properly, and a large part of that revolves around your gut health and your liver health. So when digestion is functioning well, hormones can be packaged and eliminated correctly and efficiently. But when digestion is impaired, whether it's due to chronic constipation, poor dietary habits, inflammation, or just an overall unhealthy microbiome, hormone metabolism can become less efficient. So in clinical practice, I often see women experiencing bloating, constipation, food sensitivity, irregular bowel movements, abdominal discomfort. And the first thing we focus on is elimination. So making sure you're having a regular bowel movement, making sure that you don't have any elevated inflammatory markers in your blood work related to gut health. And at the same time, these digestive issues doesn't necessarily mean you have a hormone problem, but the gut and the hormone aspect is constantly communicating. You have something in your gut microbiome known as the estrobolome, which is the metabolism of estrogen. So this is why making major decisions about hormone therapy, I always want to understand, how is your gut functioning? Are your bowel movements regular? Is inflammation present? Is the body eliminating waste efficiently? Because healthy hormones require a healthy digestion. So remember, your gut is not separate from your hormones. It plays an important role in how hormones are processed and metabolized and eliminated throughout your body. Now let's talk about foundation number 5. Before you get into hormone replacement therapy, you need to get comprehensive lab work done. Not normal labs, but optimal labs. So before even considering HRT, I always review a full set of foundational markers because standard blood work often misses early dysfunction. So that includes a full thyroid panel, so TSH, free T3, free T4, reverse T3, thyroid antibodies, because many women are told their thyroid is normal, when in reality, the conversation should be around whether their thyroid is optimal. And if the thyroid is not optimal, it drives things like fatigue, weight changes, temperature, dysregulation. And then there's also the other markers that are really important that we have to look at. So there's ferritin. Ferritin is your storage form of iron. So if you have low ferritin levels, but normal hemoglobin levels, then that directly impacts energy, hair health, exercise tolerance, and even thyroid function. Some other markers we look at is B12 for energy. So if you have dysregulated gut dysfunction, B12 gets inhibited in relation to absorption. And then we look at things like vitamin D because it plays a role in immune regulation, mood, and musculoskeletal health. A few other markers I like to look at is high sensitivity CRP, ESR. Those help me understand whether there's any kind of systemic inflammation in the body, which directly influences hormone signaling and metabolic health. And also magnesium status, because if you have low levels of magnesium, it underpins sleep quality, It reduces your ability to deal with chronic stress. So the point for number 5, foundations of health, optimizing your lab work, is not to over test. It's to properly understand physiology before layering a powerful hormonal intervention. And remember, you don't accept mediocrity as a clinical endpoint. What I mean by that is a basic panel when your doctor tells you your labs are normal is like saying, you've got a C plus in your lab work. It means you're not in overt dysfunction, but you're also not likely functioning at your best. So disease prevention is really not about waiting for things to happen. It's about identifying early physiological imbalances and correcting them before they become a pathology. And that is the standard I hold before even considering hormones. So when we bring all of this together, the point of this conversation is not to be anti-HRT or pro-HRT. It's to slow down the conversation long enough to actually look at what's happening underneath the symptoms. Because what I see over and over again is not only low estrogen when women are struggling with their health, it's metabolic health, muscle mass, gut integrity, nervous system regulation, and then overall lifestyle. When those systems are unstable, hormones become one piece of a much larger picture, which is why HRT is never the starting point in my clinical reasoning. It's one possible tool within a much broader assessment that we do. And the final and arguably most important layer of this entire conversation is risk assessment. So before anyone considers hormone therapy, we have to look carefully at family history, personal history, and individual risk factors, especially anything related to hormone-sensitive conditions and cancer risk profiles, because there are real risks that do need to be understood. And while the research continues to evolve, it's not fully conclusive in every population with every formulation and timing of use. So the decision around HRT should never be rushed, simplified, or based on symptoms alone. It should come from a full clinical picture between patient and doctor, and where you weigh the benefits, the risks, and the underlying physiology of the individual. And I say this not from theory, but from years of clinical practice working with thousands of women navigating this exact transition. And the most consistent pattern I've seen is this: the women who feel the best long-term are the ones who don't jump straight to HRT, but they're the ones who really build the foundation of health and understand their body and make decisions from a place of clarity. And this is the standard I believe this conversation deserves. And that's one of the reasons I decided to make this video. So if you find that this information is valuable for you, then like and subscribe. And I really hope that I can give you information and insight that you're not given from the conventional medical system.